Cardiologist with a specialty in women's heart health. I want to talk to you today about a subject that is, quite frankly, a matter of life and death. And it's a subject that is dangerously misunderstood. When you hear the words heart attack, what do you picture? I'm willing to bet you picture a man. He's in his 50s. He clutches his chest. He feels a crushing elephant on the chest pain, and he dramatically falls to the floor. We've all seen it in movies. I call this the Hollywood heart attack. Now, I am here today to tell you, especially for you, if you are a woman over the age of 60, that this image is not just a stereotype. It's a deadly one, because your heart attack will probably look nothing like that. For decades, heart disease has been studied and marketed as a man's disease. The research, the clinical trials, the diagnostic protocols, all of it was based on a male model. The devastating result is that women, particularly senior women, are being misdiagnosed. They are sent home from emergency rooms. They are told they're having an anxiety attack. They are told it's just indigestion or fatigue or stress. And they are dying. Heart disease is the #1 killer of women. It kills more women than all forms of cancer combined. And the primary reason is that we are failing to recognize the symptoms. The symptoms in women are different. They are subtler and they are often atypical. Today, we are going to change that. I am going to walk you through step by step what a heart attack actually feels and looks like in a woman over 60. This information is not meant to scare you. It is meant to protect you. It is meant to arm you with the knowledge that could save your life, or the life of your mother, your sister, your wife, or your friend. Part 2, why after 60, the estrogen shield is gone. So why is this conversation so critical, specifically after 60? The answer, in a word, is menopause. For the first 4 or 5 decades of your life, you had a powerful built-in superhero protecting your heart. That superhero was estrogen. Estrogen was your heart's best friend. It helped keep your blood vessels flexible and elastic. It helped your body maintain a healthy level of good cholesterol, or HDL. It helped manage your blood pressure. It was an anti-inflammatory, protecting the delicate lining of your arteries. And then, around your 50s, that protection begins to fade. After menopause, and certainly by the time you are 60, that estrogen shield is gone. Your bad cholesterol, or LDL, starts to rise. Your blood pressure naturally creeps up. Your blood vessels become stiffer. Your risk for heart disease doesn't just catch up to a man's, it often surpasses it. There's another crucial difference. Men often develop blockages in the large main arteries of the heart, the coronary arteries. These are easier to see on a standard test, like an angiogram. Women, however, are far more likely to develop something called microvascular disease. This is heart disease that affects the tiny, tiny little arteries that branch off the main ones. Think of it this way. A man's problem is like a clog in a giant sewer pipe. It's big, it's obvious. A woman's problem is like 1,000 clogs in the tiny little pipes all over the house. This microvascular disease is harder to detect, and it often presents with different symptoms than a big main artery blockage. This is why, after 60, you are not only at a higher risk, but you are also playing a different game. You need to know the new rules. Part 3, the 5 atypical symptoms that are actually typical for women. So, let's get to the list. I want you to burn these symptoms into your memory. They often appear in combination, but even one of them, if it's new, sudden, or unexplained, is a reason to take action. Symptom 1, profound, unusual, and sudden fatigue. What it is. I am not talking about the tiredness you feel after a bad night's sleep or a busy day. I am talking about a sudden, overwhelming, flu-like exhaustion. What women say, I felt like I couldn't lift my arms to make my bed. I was walking to my mailbox and suddenly felt like I had run a marathon. I was so tired I had to sit down in the middle of grocery shopping. Why it happens. The heart is a pump. When that pump is blocked and struggling to get oxygen, it cannot pump blood effectively to the rest of the body. Your entire system is being starved of fuel. Your body, in its wisdom, is sounding an alarm by shutting down all non-essential activity. The red flag. This fatigue can come on for days or even weeks before the actual heart attack event. It's a key warning sign. If you suddenly feel an exhaustion that is completely out of character for you, listen to it. Symptom 2, shortness of breath, dyspnea. What it is? This is a very common and very often missed symptom. It's the feeling that you just can't get a full, satisfying breath. What women say, I was just sitting and watching TV and I couldn't catch my breath. I would lie down at night and suddenly feel like I was suffocating. I had to sit up. I felt winded just walking from the kitchen to the living room. Why it happens, when the heart fails to pump blood forward, that blood gets backed up. And the first place it backs up is into the lungs. Your lungs become congested with fluid, making it feel like you're drowning from the inside. The red flag. The key here is shortness of breath without exertion. It may or may not be accompanied by chest pain. Often, it's the only symptom. Symptom 3, pain or discomfort in other areas, not the chest. What it is, this is perhaps the most confusing and most critical symptom. Where it is, the back, a sharp, burning, or aching pain between the shoulder blades. The jaw, a deep, aching pain in your jaw, sometimes radiating up to your ear. Many women think it's a dental problem, like TMJ. The neck or throat, a feeling of tightness, choking, or pressure like a rope is being tightened. The shoulders or arms, a general aching, heaviness, or numbness in one or both arms, not just the left. Why it happens, this is called referred pain. Your heart's main nerve, the vagus nerve, is large and has branches all over your upper torso. When the heart is in distress, it sends a pain signal up the spinal cord. But the brain, which isn't used to getting signals from the heart, gets confused. It misinterprets the signal as coming from your back or your jaw or your neck. The red flag. This pain is persistent. It doesn't go away when you stretch or move. It feels deep and unexplainable. Symptom 4, sudden digestive issues. What it is, severe, sudden onset indigestion, heartburn, nausea, or even vomiting. What women say, I thought I had the worst case of food poisoning of my life. I took 3 antacids and the pain just wouldn't go away. Why it happens, the bottom wall of your heart, the inferior wall, sits directly on top of your stomach and diaphragm. When this part of the heart is blocked or inflamed, it can irritate these neighboring organs, mimicking a stomach problem. The red flag. How do you tell the difference? A heart-related indigestion is often sudden, severe, and doesn't respond to antacids. It may also be accompanied by a cold sweat or dizziness. Symptom 5, the anxiety attack sensation. What it is, a sudden, overwhelming feeling of anxiety or impending doom. This is not a vague worry. This is a visceral, physical feeling that something is terribly wrong. What women say? I just felt terrified, for no reason. I broke out in a cold, clammy sweat. I felt dizzy, lightheaded, and my heart was racing. Why it happens? This is your body's fight or flight system, your sympathetic nervous system, going into absolute overdrive. Your brain and heart are being starved of oxygen, and your body is triggering a massive adrenaline dump to try and save itself. The red flag. This is especially important if you do not have a history of panic attacks. A sudden panic attack out of the blue, combined with a cold sweat, lightheadedness, or any of these other symptoms, is a 911 call. What about chest pain? Women do get chest pain, but again, it's different. A man's pain is crushing. A woman's pain is often described as squeezing, pressure, fullness, tightness, or aching. It may not be in the center of the chest. It might be all over. It may feel more like a bra is too tight than an attack. It's this vagueness that causes so many women to hesitate. Part 4, your action plan, the non-negotiable rules. So, you're over 60. You're feeling 2 or 3 of these strange, vague symptoms. Your brain is telling you, it's nothing. You're fine. Don't be a bother. I'll just lie down. I am here today as your cardiologist to tell you to ignore that voice. Here is your non-negotiable action plan. Rule 1, do not wait it out. Do not lie down. Do not see how I feel in an hour. Do not take a nap. In a heart attack, time is muscle. Every single minute you wait, more of your heart muscle is dying. That muscle does not grow back. Waiting is the single most fatal mistake you can make. Rule 2, do not drive yourself to the hospital. And do not let your husband or your friend drive you. You must call 911 or your local emergency number. Why? Because the ambulance is a mobile emergency room. The paramedics can start life-saving treatment in your driveway. They can do an EKG. They can give you oxygen. They can administer medications. If your heart stops, they can restart it. Your car cannot. Rule 3. Chew 1 325 mg aspirin, unless you are allergic. Call 911, and while you are waiting, chew, do not swallow, 1 full-strength aspirin. Chewing it allows it to be absorbed faster through the lining of your mouth. Aspirin is a blood thinner that can help break up the clot that is causing the attack. Rule 4. Be your own advocate. This is the most important rule. When you get to the emergency room, you will be tired, scared, and in pain. You must look the doctor or nurse in the eye and say these exact words. I am a woman over 60, and I am having symptoms of a heart attack. Do not say, I think it's my digestion. Do not say, I'm sorry to bother you, I just feel anxious. Use the words heart attack. List your symptoms clearly. I have unexplained nausea, jaw pain, and shortness of breath. This language triggers the right protocols. It forces them to take you seriously. You must be your own strongest advocate. Part 5. Conclusion. Trust your body, share this knowledge. Music swells to a warm, empowering, conclusive theme. The female body is incredibly wise. It sends us signals. After 60, those signals may be quieter, they may be less obvious, but they are there. Your intuition is a powerful diagnostic tool. If you feel that something is just not right in your body, trust that feeling. You know your body better than anyone. The Hollywood heart attack is a myth that is costing us our mothers, our wives, and our sisters. Please share this video. Talk about these symptoms with the women in your life. We have to change this narrative. We have to stop dying of a disease that is, in many cases, treatable and survivable. If only we know what to look for. Listen to your body. Trust yourself. And please take care of your heart.